And he came in on his third session. He was able to activate his hamstrings for the first time in 10 years. And his wife was holding his hand, and he lifted it out of her hand, and her hand shook, and we all cried. And that was for sure one of the coolest.
I'm Garrett Salpeter, and I believe that the most powerful and transformative way to help people recover from pain and injury, heal from trauma, and reach their highest levels of fitness and performance is to focus on the nervous system. In this podcast, we'll share knowledge from the frontiers of neuroscience and inspirational stories of how applying that knowledge has empowered people from all walks of life to heal, adapt, and grow. We are here today with Laura from our NeuFit headquarters team and Neubie team. And I'm so excited for you to be here and share your story. So thank you for being here, Laura.
Thank you.
And Laura has a very interesting background. She is a DPT and has been in practice, had been in practice for about 10 years before we met. And can you just tell us a little bit about your history and your career path before we started working together?
Yeah, so I've been, like Garrett said, a PT for just over 11 years now. And I've always been working in some sort of background with neuro. So either an acute care hospital, in a trauma ICU, or an inpatient rehab hospital, and also outpatient neuro and vestibular clinics. And neuro is really kind of my passion, and so it's been really rewarding to see people from the time they initially get into an injury all the way into the outpatient world. It's great to be the first line of defense to help someone sit up in an ICU, and then it's also great to be able to see them in an outpatient setting where they're just starting to walk more and get back to their daily life. Mm-hmm. So it's been a rewarding career for sure.
Any particular high points from those 10 or 11 pre-NeuFit years?
I would say there was a time where I was working actually for a hospital in Austin and also at the same time a rehab hospital in Austin. And so I had one shift at the hospital in an ICU, and we sat up a girl, and she had this long, beautiful red hair. And there wasn't a lot she could do when she was sitting. She was on a ventilator. So we kind of just brushed the knots out of her hair. And then, the next day she was gone. So about a week or two later, I went to work at the inpatient rehab hospital. And I had walked by a patient's room who had this beautiful long hair. And she was sitting Indian style on the bed. And I did a double take. And I was like, is that her? So it turns out that was her, and she was walking and talking, and this was only a week different. So to be able to see someone in both of those settings was one of the coolest things that I've experienced so far.
Cool. I hadn't heard that story.
Yeah.
Very cool. And can you then, going chronologically here, can you talk about how we first got connected, or your first experience with NeuFit? So
I had a foot injury, and actually, my husband was working in Houston, and there was a cryotherapy place there that said, oh, she should go use the Neubie, and the headquarters are there, and she should go talk to Garrett. And so I came in, and I had no idea what to expect. It's not anything I had heard about before. And so Garrett did a scan and worked on my foot, and I was like, what just went on? And then as I learned more about it, I didn't really think about my foot anymore, but I was like, well, what could this do for my neuro patients? And so we had kept in touch, and then next thing you know, I was at the course in February of 2018, I think. Maybe 27. Anyway, so I went to the course, and then my head exploded, and I wanted to know all the things. And a couple months later, we, I guess, kind of had an interview, and he was looking for a PT, and I said, I'm your girl. So that's how it started.
So coming from that background where you're on the front lines in the thick of it, neuro PT setting, hospital-based inpatient clinics, what are some of the differences that you experience between NeuFit and how we're doing things and the more traditional PT approach, generally, or in neuro, just kind of your perspective?
So I think one of the important things is that the Neubie and the NeuFit principles, they don't replace what we do as therapists. It's just an added tool. But I think overall, it's really helped me to think outside the box a little bit more. And I feel like I've been more creative. So you're a little bit tied down when you're at a clinic or a hospital, and there's rules, and there's only, so much time really to even be creative with our treatments. And so being able to learn what I have in the course and then work with this technology has just opened my eyes to a lot of things that either we didn't learn in PT school, or of course technology that we don't yet have in the hospital. So I feel like I've just been more creative, and to be able to work with the team here, and everybody's open-minded and we all bounce ideas off each other. It's just been a really good change, and good refreshing change, I would say.
That's awesome. And what are some of the high points, or the biggest successes you've had with patients now that we've been working together here at NeuFit?
So one of the things, as I was transitioning out of the hospital, because I've always worked in an acute care setting because I love being the first line of defense and being able to see people do things for the first time, I thought that one of the things I was going to miss was, like I talked about, being able to sit someone up for the first time or take their first steps. But those stories have continued to happen here, which is one of the greatest things. So one thing that sticks out is I had a patient here who had a spinal cord injury over 10 years ago. And he walks with canes, but he hasn't been able to activate his glutes or his hamstrings since his initial injury 10 years ago. And he's tried all sorts of therapies in the past, and he's been at it for 10 years. And he came in on his third session. He was able to activate his hamstrings for the first time in 10 years. And his wife was holding his hand, and he lifted it out of her hand, and her hand shook, and we all cried. And that was for sure one of the coolest things. And he's also been able to do bridges since then, which was something that he could never do before. So that's certainly one of the best stories.
What's their code name for their NeuFit treatments? Operation
Bring That Booty Back. And it's coming back.
That's right. We'll have to have them on the podcast too.
Yeah, we should.
Yeah.
And I think in general, people, so I had another patient who came in a wheelchair. He had been about 6 months post-stroke, had been working in rehab, and still kind of was dependent, so we had to lift him from the wheelchair to the table. And within 2 months, he was walking community distances with a cane. So one of the most rewarding things, and these are stories that I kind of see very frequently, is people hit plateaus, especially in the neuro population, where they've been at therapy for months or years, and then they start using the Neubie, and all of a sudden, with work, but way faster than with traditional therapy, they're hitting these milestones and getting over these plateaus that they haven't been able to for months or years, and that never gets old.
That's awesome. Changing the trajectory of that process, right? From little bits to just more dramatic progress.
For sure.
If you're ready to supercharge your practice, listen to this. Garrett and Team NeuFit have just released a new online course entitled Introduction to the NeuFit Method. In this detailed 8-hour course, you'll gain mastery of the fundamental techniques in our practice, including muscle testing and activations, nerve glides, and joint articulations. You'll also get introduced to our patented direct current stimulation device, the Neubie, an incredible machine that's empowered professionals just like you to help their patients heal, adapt, and grow faster than they ever thought possible. To learn more, go to www.neu.fit/learn. And now back to the show.
We've had some what-if conversations, and I want to ask you, Laura, what do you think it would be like if they had the Neubie in the hospital settings where you've worked, and what type of impact do you think it could have in that world?
So I think about that a lot, especially as I transitioned from half NeuFit, half hospital. And every time I would go to the hospital, I thought, well, what if we were able to get the Neubie on patients when they're in the hospital, whether it's in the ICU after an accident or a post-knee replacement, like day 1 or 2, what could happen? Because I feel like, a lot of what we do with the Neubie is we're trying to re-educate these pathways that have been shut down for whatever reason, trauma, surgery. And if we were able to get into their system and help it along prior to it atrophying or shutting down, then I think people would for sure move better and faster after knee replacement, get range of motion back sooner. I think people would get off ventilators sooner because they could move around more and get their lungs working. I don't know, maybe we could avoid foot drops. So these are all things that go through my head all the time about what if we could get, the Neubie on them, since there's really no risk after many surgeries that I see and many patients I see, what could happen if we got in before their systems were had time to atrophy or waste away. So.
And that's so interesting to hear you say that, because when we talk about neuroplasticity, it really is a double-edged sword. There's a specificity to it where we're always adapting to whatever it is we're doing. And that can be good if we're doing the right things, but there also is a learned disuse component to that, where if we're not doing something, if you have a patient who's just had a stroke or a spinal cord injury or something like that, and then they can't move or it's difficult to move, then they don't move, and then use it or lose it. Then they adapt to that, and so being able to prevent some of those more negative adaptations could really help the overall recovery process, right?
Absolutely.
That's awesome. Well, thank you so much for being here.
Thank you.
Thank you for being part of our team. We're very grateful to be able to work with you and love working with you, and we're excited to keep the success stories coming.
Yep, sure. Thank you.
Awesome. Thanks a lot.
Thank you so much for listening to the Undercurrent podcast. If you enjoyed this episode, please consider leaving a review and be sure to subscribe to stay up to date as we release future episodes.